Hello, everybody. I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Fabian, who's a professor and chair of the Department of Medicine at Mayo Clinic in Jacksonville, Florida. She's also the director of the Mayo Clinic Center for Women's Health and the medical director of the North American Menopause Society. Welcome, Stephanie. So glad you can join me.
Thanks so much for having me.
So I want to focus for our patients who are watching this about the concept of this term genital urinary syndrome of menopause, and really what does that mean, because it's such a mouthful. So for a patient, what are we talking about?
Great question. So just what it says, genitourinary. So what that means is the genitals and the urinary system are impacted by menopause, and we lose estrogen around menopause. And what that does is that estrogen effect is really what causes the moisture, the lubrication, that sort of thing. And when we lose that, we tend to get a little bit of vaginal dryness, maybe sometimes pain with sexual activity, but also urinary symptoms like going to the bathroom more often, a little bit of discomfort with urination, even urinary tract infections. And so those can be quite bothersome symptoms. And sometimes those are the major symptoms, even more so than sometimes vaginal dryness. I think it's also important to note that you don't have to be sexually active to have these symptoms, that even sexually inactive women can have these bothersome symptoms associated with loss of estrogen at menopause.
So I'm going to play the patient advocate. Gee, I went into menopause when I was in my 50s. I had terrible hot flashes. They're gone. Isn't what's happening to me now that it's just a process of aging? Isn't this inevitable? Doesn't this happen to all women and you just put up with it?
No, you don't have to put up with it. And no, actually, it doesn't happen to all women. We think it happens to probably around half, a little more than half of women. It's more common in women who have early menopause or removal of the ovaries as a cause of menopause. And it's actually more common in women who have breast cancer and undergo treatments with aromatase inhibitor therapies and other endocrine treatments. So we know that the majority of women going through menopause are probably going to have at least some of these symptoms. And it's not associated with aging, it's associated with menopause. And the key here is that we can do something about it.
So let's talk about doing something about it. Let's say as a woman and a patient, I just don't want to take a prescription. Is there anything that I can do?
Yes, absolutely. So we have some over-the-counter treatments that are available. They are lubricants and moisturizers. Lubricants are used for sexual activity, just before sexual activity. They're often either water-based or silicone-based or a combination thereof. And then moisturizers are, I call it face cream for the vagina. They are used on a regular basis to help maintain moisture. So they can be used every day, every other day, but they're really for comfort and to help lock in the moisture. So two different things, but both are over the counter. And even if you do use a prescription product, these can also be used in conjunction with those.
So let's move on to a prescription. Let's say I've tried the moisturizers and the lubricants. It's just not enough. What next?
So lots of prescription options available here. And that's the great thing is we have choices now. Vaginal estrogen products, there are several. We have low-dose vaginal estrogen creams. We have a vaginal insert that's used twice a week. The creams are also used twice a week after an initial period of a little bit more to get going. There's also a vaginal tablet twice a week, and there's a vaginal ring that's actually put in place and for quite some time pulled out and put a new one in. So lots of options. There's a vaginal DHEA too, which DHEA is a pro-hormone, and that insert is used on a daily basis. And then we have an oral medication called ostemethyne for those women who really want a non-vaginal option. So again, lots of options. All of them are effective. It really comes down to personal preference about what seems to be best for you, what you will take, what you will use, and cost issues, which can be significant.
But what about safety? You know, a lot of women are prescribed these products and they have a conversation with their healthcare practitioner, and then they go home and there's a big black box warning. And if you read the black box warning, it is quite worrisome. What does that mean and why is it there?
It's really scary. So it's there because the regulatory bodies that help us take drugs safely have put it on there as a class labeling. What that means is that any estrogen product, whether it's something you take by mouth or whether it's this very low dose product that you use vaginally, has the same warnings on it, which is not really helpful for women because those same warnings that are there for systemic estrogen therapy, like breast cancer risk and heart disease risk and stroke risk and dementia risk, et cetera, those really don't apply to these very, very low dose estrogen products that we use vaginally. And we have plenty of data that is where we study women long term, look back and see, did they have any problems with these products? And indeed, they are not associated with any bad long term side effects to health. And so we know they're safe even when used long term. So I think that it needs to be emphasized for women that these products are known to work and they are safe.
Okay, so I've also seen as a consumer and a patient walking around these laser therapies that use the phrase vaginal rejuvenation. What does that mean? Is it the same thing as taking a local estrogen? And is it safe?
Well, there's something really offensive about the need for vaginal rejuvenation, just anecdotally. But so there is some evidence for effectiveness for these laser treatments for what we call this genitourinary syndrome of menopause. So initial looks at these studies show that they may well be effective. What we don't know, though, is are they effective over the long haul and are they safe over the long haul? And so additional studies need to be done before we can go ahead and say, you know what, this is one of those first line treatments that you should be using. So I would say stay tuned on that. We have what we have so far looks promising, but I think we need longer term studies to be sure.
And before I let you go, for women who are out there and well into the established menopause, noting some dryness or pain, but their doctor never seems to ask about it, a word of advice.
I think women need to be their own advocates here. And so if you are having trouble with vaginal dryness or with urinary symptoms that are really bothersome, you need to talk to your doctor or your healthcare provider about that and say, you know what, I'm having these symptoms. They're affecting my quality of life. Is there something that can be done about it? So we would hope your provider would ask you, but if your provider does not, please do bring it up because there are things that can be done.
And they're safe, and they're effective, and they're well studied.
Indeed.
Thank you so much for joining us today. I think this is such important information for women. Thanks all.